All right, welcome to the first ever Volume 1, Episode 1 of Sacramento County Sheriff's Podcast. And no better guest to kick this off than Sheriff Cooper himself.
Thank you. Excited to be here. It's a good thing. I'm excited about it. Number one, to inform the public what's going on with the Sheriff's Office. Number two, for our folks that work within the office. So just a lot of things going on. Law enforcement is a very interesting occupation. And there's so much going on with mental illness, homeless, retail theft, human trafficking. We go on and on and on, but really to get the information out there and make the public aware of what we're doing.
Oh, we have TV, we have social media. What made you want to do a podcast so much?
Something separate. If you're taking time to drive or at home, just relaxing, just to kind of listen and hear what's going on. Because sometimes in the print media or TV media, we don't get a lot out there. It's just little short clips of 30 seconds. So we want to tell our side of what's going on.
All right. Well, we are going to be covering, like you mentioned, a lot of issues today. I mean, obviously, the one big thing that's making all the headlines is your new mental health policy. Talk to us about it.
It is. And here's what's interesting. It's like when we change our policy, I heard right away is you've always done it that way. And that just frustrates me because just because you've always done something a certain way doesn't mean it's good. And think about that.
And let's rewind. Let's talk about what it used to be. So mental health calls, someone would call and they want to hurt themselves. They're in a house by themselves or whatever the case was. Traditional response was what?
We would come out. Or someone's having one of their children, adult children's having mental health issues and they can't control them and wants to come out. And we were like the bouncer, the bodyguard on these type of things. And being mentally ill is not a crime. It is unfortunate. These families struggle. I think a lot of us see it publicly with the homeless, but what you don't see is folks that are at home behind the houses. And it's traumatic for the family to deal with that day in and day out, and they don't get a break. And sometimes they're at their wits' end. But when you interject law enforcement, and we've had some training on de-escalation, still just having someone show up with a badge and a gun, sometimes it triggers people. And we don't want a bad outcome. If you read the paper or watch TV, we've all seen bad outcomes across the country where it's happened, even here in Sacramento. And I want to get away from that. I don't want that to happen. Number one, I don't want one of my officers taking someone's life, period. Number two, my officers are traumatized. They suffer PTSD. It's different if you're in a robbery or a shootout with a bad guy, but this is someone that's having a mental health crisis. And I just want to prevent that. I mean, it's weighed heavily on me. And, I felt I had to change. And obviously the laws that changed made it that way. So we had a ruling from the Ninth Circuit Court of Appeal out of Vegas. Two officers there had to subdue somebody mentally ill. He ended up dying. And they said, because there was no crime, it was just a mental health call, that the officers can be held personally liable. So they lose qualified immunity where they can go after them personally for their houses, anything they own. And that's an issue. We also had an incident here in Sacramento where some officers assisted fire with someone that was mentally ill and restraining them. That person died. And now the officers lost qualified immunity. Another ruling came out recently also for an individual that says if someone's mentally ill and you can book them under a 5150 hold, W&I, a welfare and institution code, where they're a danger to themselves or other, that person has to agree to be transported. Law enforcement cannot transport that person. So our hands are tied. And let's say you show up at someone's house and they become violent, we struggle with them, and something happens to that person, you're liable. So it's liability. And that's not my primary concern though, but I don't want to injure or take someone's life. I don't think the family wants that either. It's liability for the county. It's liability for the sheriff's office. And my officers don't want to do that. They don't want to ever have to take someone's life. And that is trauma to them. So we're trying to avoid all of that. And it's not, throwing a sucker in the sand, but at some point, mental health specialists are trained to do this. Law enforcement, we're jack of all trades. It wants to be a little bit of everything. And we're really doing a disservice by not having mental health professionals deal with these people to really help them and get the help they need.
Now, a lot to unpack on that. So you mentioned qualified immunity, and obviously that's the buzzword, right?
Yeah.
But the underlying theme of the court ruling is what? Because the qualified immunity is what they,
Sure.
broker and mention, but really the overwhelming theme of that was.
Well, and that's a piece of that's not my primary concern is qualified immunity. What it is the court says if someone has mental health issues, we shouldn't even be involved because it's not criminal. We are law enforcement officers. We enforce the law.
Which is why they were taking the qualified immunity away.
Away, exactly. So we really shouldn't be there. The court says that. The court recognizes that. The issue is to have a robust mental health system requires a lot of money. And that's a big issue. We see that in the homeless. We don't see it enough. And I'll be honest with you, until you address the issue of mental illness and also addiction, because think about this. If someone's got mental health issues and they take drugs, illicit drugs, it's like 2 + 2 = 10. There's a lot going on there. And that's the issue with that. So we see a lot of that with folks out in the street are unhoused. And sometimes in folks in homes. So this mental health issue that we're dealing with right now is really confined to the homes. So basically, if someone commits a crime, we're going to come out. If someone committed a crime, we're going to come out. If someone's life is in danger, other than the person suffering the mental health crisis, we'll come out. So it sounds, what's interesting in the court language, once you show up, you develop a special relationship. So if we arrive on scene and have any interaction with the family or with the individual, we own that. We're responsible. We're liable for that.
And you use the term special relationship. That's not a Jim Cooper term. That's an actual legal term.
It's actually a legal term from the courts. You develop that special relationship. So you have to be very careful with that. And these are tough calls. Like I said, I have a lot of sympathy for the families and what they go through, but it's better to have mental health professionals that are trained in this. And right now, we're transferring folks to 988. Before we say, hey, call 988 and hang up. But that's not good enough. So what we're doing now is we actually stand on the line and transfer them to 988 so we get the good handoff. And from the 988 and these phone things, they resolve in about 95% of the cases. They actually do really good because they are trained mental health professionals.
And resolve them over the phone.
Over the phone, yes.
So again, I'll play devil's advocate because you're getting a lot of heat from it, a lot of criticism from it, but this isn't something you just dreamt up overnight.
Sure. I used to go back and Google police shootings and mental health. A lot pop up, fatal shootings. Why do we want to have that happen? I don't want to take someone's life where the family calls for help. But at the same time, we can't be that bouncer, that enforcer to come in and manhandle that person. We shouldn't do that. Because if something happens, and it has happened many times, and we've seen it on the news, we own it. So I'm just trying to make sure at the end of the day, we have good outcomes. That's what it's about. I don't worry about liability so much and other things. I just want a good outcome where that person is safe.
Now, the big thing is, get better training, get better training, get better training. I don't think you oppose getting better training, but that's not the crux of this issue here.
Not at all. This is a court opinion. So it's a law. I don't get to pick and choose what laws I want to apply. The court was very clear in their ruling. And what frustrates me, a lot of lawyers, well, you're reading too much into it, blah, 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 blah. Well, guess what, attorneys? You are the judges. This is a court saying this. And they went so far as to say, hey, law enforcement really has no role in any type of mental health crisis. So it's very clear what the law is. So for so long, law enforcement did everything. And hey, whether fire calls us, the public calls us, we came out. But we've got to slow that down.
We'll talk about some of the fire calls.
Yeah. I'll be honest. We had an incident where a 97-year-old woman was uncooperative. What are we going to do with a 97-year-old woman? I don't need my deputies putting hands on a 97-year-old woman. We had another call where someone had a medical issue with their foot. They needed treatment. They were locked in their room, refusing to come out. The family was there. We're not going to bust the door down. That makes no sense. And to me, the fire department should have said, hey, family, when they come out, take them to the hospital. We're leaving. Because people feel so compelled. I got to help. I got to do something. And sometimes doing something is the wrong answer.
And again, that's kind of been their thing. Like, hey, we're doing stuff that we're not trained to do.
Right. And like I said, for law enforcement, we always respond to everybody's situation. And because of the law, that's what put us here, because of court rulings. So you got to be mindful of that.
Now, going back to that training issue, because again, it's always like seems to be the fallback. Let's just say you did have a magic wand and you gave everyone a PhD and a doctorate in psychology and psychiatry. Does that change anything?
No. You saw situations where it becomes volatile. You show up, nature of the badge, you introduce a badge and gun, it turns volatile. And then you're forced to go hands-on with someone. And who knows how it ends. And that's the thing that people just keep ignoring. Because I've heard some folks say, hey, I've called them 10 or 15 times because of my daughter or son, and it's turned out okay. All it takes is one time when that bad thing happens. And then it just impacts everyone. And I just can't have that anymore. This is not something I take lightly. A lot of thought went into it, but I don't want to have another officer-involved shooting or critical incident that should not have happened because we should not have been there.
And the should not have been there, it's really on non-criminal stuff. And I think that clear distinction needs to be made, right? And I know you've said it before, but again, these are non-criminal calls.
Correct. No crime has occurred. We're law enforcement. Why are we there? This person is having a mental health crisis. Someone with a background in mental health needs to be there dealing with that person. They have the training. We don't have that training. And we've had de-escalation and we try and use that. But still, to be proficient in that, that's the issue. I mean, we get 24 hours of training every 2 years. And part of that is first aid, CPR,
sure,
driving, the legislature mandates training we have, but there's not enough training for us to do in this. And this is a specialty.
Now, we've got these specially trained folks with 988. You talked about the 95% success rate over the phone, which pretty high, obviously. You don't get 95% success rate in most things, especially in government service. What happens to that 5%?
Well, it depends. And obviously, if it turns violent or something happens, where there's a criminal component, we will come out. What was interesting, for about a week, we tracked calls. I believe we had about 360 calls that had some type of mental health component, and we didn't respond to only 17 calls. That's not a lot, and no one died. So and you got to take it with that. And we've heard, well, hey, what if someone's walking in and out of traffic? Well, that's a crime, so we'll respond to that. So, and when it's not clear or we're unsure, we're going to respond.
And anything that's a public safety risk.
Absolutely. Absolutely. So I think what's going on here is it's something that hasn't been done before. It's something different. They're not used to it. And that's the uproar. And like I said, I don't get to pick and choose the laws. So law enforcement over the years have had a lot of laws that have come out from the legislature. So we're forced to deal with that, and we recognize it. For fire, they pretty much don't get laws that are passed that impact them or the mental health professionals. None of them will lose their house because it's something they do at work when they're doing their job. Nothing criminal, just doing their job. So that's the difference.
And you touch on something. We're used to this. Laws change for us every year, which in effect change policies almost every year. This is something brand new to not just fire, but probably everybody else involved.
It is. And just that we've had a ton of public outcry. There's been some, but like I said, a lot of it is you've always done it. And if not you, who? And the who is mental health professionals. So we're keeping data so we can be better informed on this and really making a difference. We take it seriously. So it's working together with the county, behavioral health services, fire, and trying to be collaborative with this. But at the end of the day, there's been far too many bad outcomes. And as sheriff, I can say enough is enough. It may rub people wrong. They may think that we're scared, but that's not it. I just don't want to end up injuring someone or someone losing their life over being mentally ill.
And talking about that, I mean, I know you, but again, the criticism's coming in that, the sheriff, the deputies, they're cold. They're callous about this, that they just don't care.
No, and we really do care. That's a big issue with that, but we don't control it. The law came out. The law is pretty much in black and white. what we can and cannot do, and how we're liable for it. Even down to transporting. Someone doesn't want to be transported. Okay, we're not going to transport you. And a lot of folks have said, hey, law enforcement transports all the time. Well, the law prevents us from doing that now. We didn't ask for that, but I have to obey the law. And these folks think that I can just choose to ignore the law. Well, I can't.
And again, you were trained in the academy then, and I just like I was, and just like we have deputies now, you're trained in 5150.
Right.
But that's changed. I mean, obviously the law is there, but the application has changed.
It's changed dramatically. And was it an overreach in some aspects? Yeah, probably. But for the most part, on a fundamental basis, it makes sense. We can't criminalize people having mental health crises. And by putting us in there, inserting us, you're criminalizing it.
And I do want to make a distinction because, again, just hearing from the public, I mean, you're out there all the time. People are talking to you all the time.
Right.
And, we hear on social media and everything else. Law enforcement can't place someone on a hold. We can apply for a hold. And there's a very clear distinction. It is an application for a 72-hour hold.
And the doctor makes a determination.
And just because we apply for it and maybe they are they voluntarily go and they cooperate and they want to go, and the family is very well aware of the mental health issue, and we do take them to the hospital.
Yes.
But the doctor says they're fine 3 hours later, and 3 hours later they're out the door.
That happens a lot. And part of the problem is we don't have mental health facilities. The mental health facilities are the emergency rooms. When I was in the legislature, the ER docs were putting forward a bill to be able to discharge patients sooner to free up bed space. And that's the issue. The downtown jail, we have a lot of inmates that are under our jail psych unit. So it is rampant, and really you need places for these folks to go and get treatment. If you're having a mental health crisis right now, where do you go? Where are you taken to? The emergency room. We're failing them. But I do law enforcement. So someone else has to work on that, our legislature, our local officials, to find a place for these folks to go to get the treatment they need.
Under Sheriff Ziegler actually cited something that, blew what little hair I have, but it blew it back. Can you name the largest facility providing mental health services in the county of Sacramento?
The Sacramento County Main Jail. And that's crazy. Like I said, it's not a crime, but your biggest mental health facility is the sheriff's department. I'm going to call BS on that. It should not be that way, but that's what we're forced with. And that's the issue. It's been criminalized and it shouldn't be. So now we're drawing that line in the sand where I'll tell you what, people are having conversations right now that they never would have had about this, how they're going to attack it. I've heard from departments across the state, law enforcement, and the nation about our policy, wanting copies, thinking they're going to do it. And it's also bringing the mental health professionals there to figure out how they address it. But something has to change. Someone had to be the person to take the bullet on this. And it's me, but I'm okay with that. Because at the end of the day, for my constituents, I want to make it safer. I want to make it safer for my deputies.
And to be clear, if you've committed a crime, we're coming for you.
We're coming for you, yeah, absolutely.
Yeah.
But if you're just having a bad day, no, we shouldn't be any part of that equation. Like I said, the biggest thing is this: we've always done it this way. People are so used to it for years, and now to do something different, they're not used to it, and people have a hard time with change. And that's one thing in law enforcement, because we are regulated to the end of the earth all the time. So a law comes out and we've got to change. So we change all the time. These other folks have not had to change, and they are having the hardest time swallowing it.
So you actually said something that this is not my line in the sand. I'm not doing this to make a statement of sorts, right?
Right.
Can this be reversed? Can this policy be changed?
By law?
Right.
But for a bunch of attorneys that aren't judges, no, they're only opinions. I've seen legal opinions on both sides. So the law is the law. I follow the law. I don't get to choose what I want to apply and what I don't want to apply. So I've got to follow what the law says. It's a liability for the office, for the county, for the taxpayers, you know? The family may call us for help, and the outcome's bad. They're suing the county. They're suing us, and the county's paying out. We don't want that. We don't want it to have to go that far.
You've used force. We've talked about use of force all the time. There has never been an application of force that's been pretty. One of the big criticisms is, why can't your deputies not use excessive force? And that's the issue that's cited in this court ruling, is the deputies use excessive force. But probably not for the reasons you think. We've seen, examples of horrific videos of excessive force. That's not what we're talking about here. Why did the courts rule the force excessive?
So I've actually seen this video.
Right.
Because it was a non-criminal matter. That's why it was deemed excessive. Non-criminal matter, purely mental health. Someone's having a mental health crisis. That's what made it excessive.
So literally any amount of force would have been excessive in that situation.
Correct.
So going back to what we were talking about with 5150s, and if they don't want to go voluntarily, obviously the death, as tragic as it was, is an extreme example of this application of force. But take it down a bunch of notches. Put a 5150 hold where someone doesn't want to go.
And you have to, okay, you're going. I'm taking you because you're a danger yourself for others. So you don't want to go. I'm going to put hands on you and we're going to struggle. And that, under this law, is excessive force. We may go down the ground, wrestle around and stuff. You might get injured. We might get injured. It is deemed excessive force. And that's the crux of the issue, that people can't get beyond that. That's the whole focal point right there. This is real talk.
Right. And so we've talked about this, in pretty good detail. What can folks do now? Members of the public that are still dealing with this day in, day out. Obviously it's a small segment of the population, right, but it's a significant one. And it, takes up a lot of resources. It's going to take up a lot of creative solutions. But right now, what can they do?
Well, first and foremost, my heart goes out to them. My deputies see it day in and day out. They know you're suffering and what you're having to deal with. It's tough. As a state, at the state level, we've got to do a better job of giving these people assistance to get the help they need. Like I said, the emergency rooms are not the place for these folks to be treated. More treatment space for folks that are suffering from mental illness. Hell, you skin your knee or you need stitches, I go to med clinic. Folks having a mental health crisis, there's nowhere to go. So we've got to change that narrative and really put some funding towards that. And I'll tell you at the same time, also for substance abuse, because some of these folks that are mentally ill are mixing drugs with that, and that just screws them up, tenfold.
Doesn't drug court fix everything?
It does. And it's coming back courtesy of Prop 36. We lost it, and no one intended, but now we can force people into that. And I'll be honest with you, for some folks, they probably need a conservatorship. And, a lot of folks would rather have them walking out there butt naked in and out of traffic, eating out of a trash can, in the name of freedom, than to be the adult in the room and say, hey, you know what? You cannot take care of yourself. So as a state, we're going to take care of you.
And I think it's probably a good stopping point, because this will probably segue into our next episode, because again, you're talking about mental health, substance abuse, probably the two most prevalent issues in our homeless community.
100%.
So, Sheriff Cooper, anything else you'd like to add before we wrap it up?
No, but you can't build your way out of that. $24 billion has been spent on housing for the homeless. Our homeless problem has gotten larger. You have to address mental illness and substance abuse before you tackle the homeless issue. Those two are tied in together, or all three are tied in together.
And there's your teaser for episode 2. So we'll wrap this up. Thank you for joining the Sheriff's Podcast. Sheriff Cooper, see you on the next one.
Thank you.